Hello everyone, in this first video on our channel, I welcome all of you. Today we'll dig into the science of COVID-19, including its origins, clinical signs and symptoms, risk factors, diagnosis, transmission, infectious period, your frequently asked questions and certain home evaluations. Coronaviruses are a large diverse group of viruses, and as the name suggests, corona it means crown, and they infect a wide range of mammals and birds. But COVID-19 is novel, that is new. The virus is believed to be originated in bats, so bats are natural carrier, but it developed a special trick to jump between species and infect people. And then another trick to be able to be transmitted between people, and that is how it came to cause the pandemic. This kind of trick, however, is not new. This is third coronavirus since 2002. The first one, SARS, acronym for Severe Acute Respiratory Syndrome Coronavirus, emerged in Guangdong, China in 2002. Second one was the Middle Eastern Respiratory Virus, emerged in Middle East 2012, while the third one, none other than SARS Coronavirus 2, emerged in Wuhan, China in 2019. Signs, symptoms, and natural history of COVID-19. We need to remember that not everyone who is infected gets sick. So not everyone develops signs and symptoms. So let us look at what are the signs and symptoms, how long does the sickness last, how long can infected people spread the virus, where and how people shed virus. To get a more clear view, let us understand the difference between a sign and a symptom. Signs are objective measurements to characterize an illness and observed during physical exam, for example temperature. But symptoms, however, are something which cannot be objectively measured but are characterized by how the patient says they are feeling. For example, fatigue, nausea, loss of taste or smell, muscle ache, all of these cannot be measured but only be expressed by a patient. Fever can be both a sign and a symptom because it can be measured, and you can also feel when you have a fever. Some people have no symptoms at all. This is called being asymptomatic. Signs and symptoms have a wide range with this infection, that is COVID-19 infection. Commonest of all of them are high fever with chills, that is with more than 100.4 degree Fahrenheit. Some people also experience muscle pain or myalgia. Some will develop a cough. Many people think of COVID-19 as a respiratory disease and think about coughing, but not all people will have a cough. It's important to keep in mind that people who have COVID-19 may have only one of these. Some may just have a few of these, while others will have all of these signs and symptoms. So there's not one right way to define COVID-19. Many signs and symptoms are non-specific, that is, they are common to other infections as well. So people with these signs and symptoms may have COVID-19, but it's hard to tell without a test. Some signs and symptoms are more specific, and that's the recent loss of ability to taste or smell. About 1/3 of patients report this loss of taste or smell, and it's a bit more specific for COVID-19 because it's very rare in other types of infection. Most common signs of progression of infection are increased or more severe fever and increased difficulty in breathing. Patients should immediately seek emergency care if they develop any sorts of these warning signs and symptoms, also including bluish lips or faces, expressing hypoxia. Anyone who develops a new onset of confusion, that's then a very serious complication. Now let us proceed and look at the risk factors. Risk factors include diabetes, hypertension, any lung disease like bronchial asthma, emphysema, COPDs, heart diseases, liver diseases, or any kind of kidney disease. People who have weakened immune system are also at very high risk. For example, HIV patients or people taking steroids which are immunosuppressants like prednisolone, betamethasone, or patients undergoing chemotherapy. Extensive overlap of other respiratory diseases like influenza, rhinoviruses, whooping cough, and atypical pneumonia make a patient much more susceptible. Now, how does someone die due to COVID-19? First of all, lungs aren't able to recover because of the fibrosis, which is irreversible, and if the virus damages the lung parenchyma too much and the patient is unable to breathe on their own, that is one way probably that someone could die due to COVID-19. Another way is through lack of oxygen. So that can damage many of your other organ systems, and you need all of these to function in order to survive. Damage to these organs can put you at an increased stake of developing a heart failure, kidney failure, stroke, or a blood clotting disorder. So here I have mentioned about two of the most important and practically applied diagnostic techniques for detection of COVID-19 virus. The first one of them is a reverse transcriptase PCR test, which is abbreviation for polymerase chain reaction. A PCR test is a diagnostic test that identifies virus in the body. SARS CoV-2 has DNA and RNA sequences that are unique and specific to the virus. That is, no other virus or organism has these sequences. The SARS CoV-2 PCR test assesses for these sequences. If they are present, the test is positive. It is important to recognize that this is not a culture. These tests just assess for the nucleic acid sequences. PCR tests for SARS CoV-2 are usually done from swabs taken from the back of the throat or nose. The second test we're going to discuss about is an antibody test. After a person is infected, he or she typically develops antibodies. Antibodies help the body fight infection and in many cases develop immunity. Antibodies are found in the bloodstream and in body secretions such as saliva. The antibodies that are most important in SARS CoV-2 are called IgG antibodies. IgG develops 10 to 14 days after a person is infected. Antibody tests of the blood and in some cases saliva can detect whether the antibody is present or not. A positive antibody test is evidence that the person had SARS CoV-2 infection. At the current time, we don't know whether this means whether the person is immune. In other words, we don't know whether the person is protected from reinfection. Coming forward towards home testing and evaluation. Now, there are many different things available on the web, but this one is the most reliable and preferred test of choice by several medical practitioners. Now, recommendation here made is a 6-minute walk test wherein you walk at a regular pace and then monitor the oxygen saturation once the walk completes by pulse oximetry. If it drops beyond 7 to 8%, we can definitely make sure that the lung parenchyma is certainly involved. This is seriously alarming. Before you get severe consolidation and progressing pneumonia, it is highly recommended to visit the doctor because COVID-19 could lead to happy hypoxia, wherein your body's oxygen levels are low, but there are no certain signs of hypoxia. There are 3 levels of severity in COVID-19 infections. The first one is a mild infection wherein you have sore throat and body ache, and the patient is generally advised a home quarantine where he is preferentially isolated at his home in a well ventilated room. The second one is moderate infection wherein the patient expresses pneumonia and hypoxia. He is advised admission. While the third one is a severe condition wherein he is placed in ICU expressing bilateral pneumonia, hypoxia and dyspnea or breathlessness. Once the patient gets admitted, medicines are prescribed only for symptomatic relief. For instance, hydroxychloroquines, anti-inflammatory drugs like tocilizumab, steroids like dexamethasone, antiviral drugs like remdesivir, avifavir, Fabiflu, blood thinners or anticoagulants which could prolongate the clotting time and reduce blood coagulation are also being prescribed nowadays. For instance, warfarin, heparin, etc. Now, patients who are above 55 to 60 and have comorbidities should be advised immediate admission. So that's all for part 1. If you're still watching it, I want to express my sincere gratitude. In our next part, I'll be talking about incubation and infectious period of COVID-19, reproductive number and transmission of this infection. Thanks for watching. If you liked this video, please make sure to like and subscribe for more.